Hi guys, Angela back here, one of the nurse practitioners from Revitalize. Last week, Taylor Lofton, our nurse practitioner, talked about testosterone hormone, and this week we're going to talk about thyroid hormone. I think a lot of times thyroid is forgotten as one of our hormones. So thyroid hormone is also a hormone. It collaborates with the rest of our natural sex hormones to help us function day to day. So just as several of the other hormones, the thyroid hormone originates from the pituitary, and there's a feedback loop. The pituitary is in your brain, and it communicates with our thyroid. So the pituitary releases thyroid stimulating hormone, which you'll hear us refer to as TSH often in your appointments. And this communicates to our thyroid to release T3 and T4, which are two different thyroid hormones. So if you're a patient here at Revitalize, you'll see on your little spreadsheet that we make of your hormones once a year or more, depending on how often we're looking at it. We break down for you your TSH, your T3 free, and your T4 free. So those are three thyroid hormones that we like to look at, so we can see how that feedback loop is working, and why we stress the importance of thyroid so much is it, as Dr. Ramsey puts it, it is responsible for the cell turnover in our body, which to simplify that, thyroid is responsible for our metabolism, but it's a little more complicated than that. The food that we eat, everything that we put into our body, it helps to metabolize that. So it turns that food into energy, and our body needs that energy to function. All the cells in our body, all the different processes in our body, it comes from that. It all stems from the way that everything is processed. So aside from turning our metabolism on, it helps to determine if we're having regular bowel movements, how our joints feel, how our brain is functioning. So that's why we stress looking at the thyroid numbers so closely. Now, we do things a little bit differently here at Revitalize. So there are certain ranges that you'll see if you go to any lab facility that gives you a quote unquote normal range. So TSH, for example, has a very big range. The normal is anywhere from 0 to 4. Here at Revitalize, we like you to be around 1 or lower, because that's when your thyroid is optimized. So what that means is your body has enough of each of those hormones, the T3 and the T4 thyroid hormone, that it tells your brain, okay, you can calm down now. You don't have to produce as much TSH. And that is what allows our body to work a little bit better. So when we see thyroid optimized, as we like to say, so when your body has a sufficient amount of thyroid hormone to do what it's supposed to do in every phase of your life, whether you are still fertile, you're premenopausal, perimenopausal, or menopausal, we want your body to be able to function and feel the same way. So thyroid hormone, again, back to what I was going to say, when it's optimal, you have less joint pain, you have regular bowel movements. Thyroid is tricky because if you have too little or too much, you can have symptoms in either direction. So you could have constipation or you could have diarrhea. But when we optimize you, you're having regular, healthy bowel movements. Same thing with joint pain. You should have less joint pain when you're on an optimal, or when your thyroid is optimized. Your temperature is regulated better. Your focus is better. You have less anxiety. You don't have any heart racing or shakiness. So it's really, hormones are all about balance, and especially thyroid. And that really is something that we do uniquely here. We work a little bit outside of what is the conventional standard of normal, because even patients that, have a perfectly on paper thyroid condition, oftentimes they still don't feel their best, depending on what modalities the provider is using to help optimize them. And this is very prevalent to not only women, but to men. Women, of course, this can play into role of fertility, but men, this can also play into fertility, all the different body functions. Like I said, joint pain, constipation, focus. It really manifests in both men and women because we both have a thyroid, right? If you're having symptoms like this, make sure that your provider is looking at your thyroid numbers and making sure that it's optimized, not just considered normal. I hope you got a little bit of good information for this week, and next week we'll be joined by Taylor Lofton again, our nurse practitioner, to go over the next hormone, estradiol.